It's estimated that about 85% of the world's spending on health and medical research is wasted every year. That's around $170 billion per year. So if we shared our raw data that comes from research, we could significantly reduce this figure. By 2020, I would like to see more raw data shared, and I would like to see a shift in the reward system where research that is high quality, productive, reproducible, shareable, translatable, and transparent is rewarded.
Transparency in research not only refers to reporting who did what, how they did it, and what they found. Transparency in research should also involve shedding light on whether institutional affiliations are properly represented in the author byline, thus reflecting the true contribution of institutions and organizations to the research being reported. Definitions and guidelines on what constitutes a properly represented affiliation have not yet been developed by the international research integrity community. By 2020, I would like to see definitions and guidelines to help authors ethically state their affiliations when they publish the results of their research, so that ghost affiliations, in effect, affiliations reported in absence of an actual link between the author and the institution, are prevented.
By 2020, I want to see all clinical trials registered and their results reported on time. I want to see the organizations that fund and run clinical trials to audit their trials regularly and to take action when trials aren't being reported properly. Despite clear legal and ethical mandates, almost half of trials haven't been reported. As researchers retire and software goes out of date, valuable information is being lost, money is being wasted, and patient time and well-being is being spent repeating trials. Sense About Science runs the All Trials campaign that calls for all clinical trials to be registered and their results reported. We've seen some important legislative wins and improving rates of reporting, but we need funders, researchers, and institutions holding each other to account by insisting that no trial, past, present, or future, goes unreported. This is a public issue. Patients, doctors, and policymakers cannot make the best decisions about health and medicine when information and evidence is missing.
By 2020, I'd like transparency to be fully accepted as a core principle for research, that instead of the default being hidden, the default is transparent. Furthermore, I'd like to see all of those involved in research know what they need to do to ensure this general principle becomes their specific practice. So a researcher would apply principles of transparency to all aspects of how they disseminate their work, making findings, but even more importantly, the methods, the data, and if appropriate, the code fully available. Researchers would also need to be fully transparent about their affiliations and their competing interests. On a bigger scale, I'd like to see commitment to the funding and capacity building that's needed for such transparency to be fully enacted. So that means funders, institutions, journals, etc. putting resources in place to build the infrastructure for transparency. Bottom line, we need a whole-of-system approach to transparency.
I'm Matt Hodgkinson, Head of Research Integrity at the open access publisher Hindawi, where we believe in the principle, as open as possible, as closed as necessary. We want increased transparency about data and results to improve reliability. All our articles will now have a data availability statement, and we endorse the FAIR principles of findability, accessibility, interoperability and reusability. We're looking at phasing in data sharing requirements across different fields within limits like patient privacy. We also want all research published, not only positive results. Sharing data and negative findings may need funder mandates and changes in research culture. We're also working on transparency following publication. We've improved the visibility of our letters to the editor, and we've discussed the use of expressions of concern with other publishers. We made all our reference metadata public as part of the Initiative for Open Citations to help build a totally free citation network. This is part of Hindawi's wider commitment to open science, policies and infrastructure.
At Taylor & Francis, ethical practices and policies underpin our entire publishing programme. We see how researcher reward and review mechanisms directly drive the behaviours of the academic community. Sometimes these mechanisms can inadvertently drive bad behaviours. A stark example of this is how fake journals thrive in countries where researcher reward is based on quantity of published outputs. And in countries where there's pressure to publish in quality publication outlets, it's often unclear how quality is gauged. Many journals' rankings exercises are undertaken behind closed doors without clear methodologies. So at Taylor & Francis, our vision is for greater transparency in relation to funding and reward mechanisms, and for institutions and funders to apply consistent and responsible methodologies with clear frameworks. These should include recognition of the importance of publishing in legitimate publication outlets and the importance of peer review. These elements together will ultimately ensure the best possible outcomes for money spent on research.
I think I'd like to see, although I think we're improving as we go along and we become more progressive, but transparency in terms of protecting the rights of human beings who participate in research. I think it's particularly important if those people have some kind of vulnerability, and there's lots of reasons: socioeconomic, linguistic, educational backgrounds, stigmatizing diseases or circumstances where people can be vulnerable and may not understand the impact either of participating in research or what happens when the research gets published, particularly if it becomes popularized and important to the public, and they may not feel comfortable when they may be identified, even if it's anonymous data, but by virtue of their membership in a group might feel particularly vulnerable when the research is published.